Hello and welcome to Family Voices Nuts and Bolts of Telemedicine webinar series. This is the fourth webinar in the series and the final webinar. And today we will cover your family's first telemedicine appointment and the essentials for a family-centered telemedicine experience. Let's get started. We always like to start off with an acknowledgement to our funders. This program is supported by HRSA, the Health Resources Services Administration of the United States Department of Health and Human Services. And let's also start off with a quote. When I is replaced with we, even illness can become wellness. This was spoken by Malcolm X. So what will we be covering today for this webinar number 4, Your Family's First Telemedicine Appointment? We'll be talking about tele-what. If those terms confuse you, we'll be clarifying those once again. We'll talk about the Fab 4, which we're on number 4 this webinar. And we'll be talking about family-centered telehealth. We'll also be sharing some patient rights and responsibilities. And then we'll break the visit up into 3 segments. Before the visit, which will cover insurance, accommodations, 4 things you need before the visit, and we'll review, are you connected? Do you have a device? And can you see your provider? Then we'll talk about during the visit, what goes on during the telemedicine appointment. And then finally, we'll wrap up with next steps and after the visit. We will also share with you some bloopers and success videos so that you can understand what a telemedicine appointment should look like. At the conclusion of this webinar, we hope that you should be able to identify 4 ways to prepare for your telemedicine appointment. Number 2 is to identify accommodations that your family may need for a successful appointment and how to ask for them. And number 3, identifying one strategy to avoid or improve a difficult telemedicine visit so that you can have more success for the next one. So we use a lot of words that start with tele, and you might be thinking, tele what? So let's see if these circles will help you understand what some of these words mean. We're going to start off with the smallest circle, which says telemedicine. Telemedicine is often used interchangeably with the word telehealth, but it's technically focused on the clinical aspects of care. That means things like a video appointment with your child's pediatrician or a virtual therapy session with your young adult speech therapist. There's a little bit larger circle that's coming onto the screen now for telehealth. Telehealth is really the use of electronic information and telecommunication technologies to support a number of different activities. One can be what we just talked about, long-distance clinical healthcare or a telemedicine appointment. Telehealth can also be patient and professional health-related education, such as we're doing here today. And it can also include public health and health administration. Some of the technologies used in telehealth include things like video conferencing, the internet, store and forward imaging, streaming media, and landline or terrestrial and wireless communications. There's one more circle that's a little bit bigger than all the other 2. And this includes and encompasses digital and connected health. Digital and connected health is the use of digital, mobile, wearable, and other innovative technologies. These technologies can facilitate things like tracking and monitoring of health status or behavior outside the clinical encounter. But the goal of this digital and connected health is to be patient-centered, technology-abled, and have insight-driven healthcare. Let's move on to the Fab 4. The Fab 4 are the names of the 4 webinars in this series. The first webinar was, Are You Connected? The second one was, Do You Have a Device? The third one we discussed, Can You See Your Provider? And finally, the 4th one, we will be discussing your family's first telemedicine appointment. And that's where we are here today. So let's start off by talking about what does family-centered telehealth actually mean? Family-centered telehealth is just a way of providing services through a variety of digital platforms that assures the health and well-being of children and youth with special healthcare needs and their families through respectful family professional partnerships. Family Voices has developed a family-centered telehealth rights and responsibilities document that we will be referencing today. Please be sure to look it up to see the entire document, as we will always only be highlighting a couple of aspects. So let's start with family-centered telehealth rights. One right that you have as a family member receiving telehealth is that you have the right to receive considerate, respectful, and compassionate care through telehealth, regardless of your age, gender, race, national origin, religion, sexual orientation, gender identity, or disabilities. You also have the right to disagree with any plans of care or ask for a review of changes to the plan of care in the telehealth visit, just as you would during an in-person visit. Next, you have the right to ask questions and ask your provider or the appropriate office staff how to log on and get assistance with the platform. But you also have the right to share information or symptoms and ask questions during a telehealth visit, just as you would during an in-person visit. And documentation. You have the right to receive the same type of information, such as test results or diagnosis, during telehealth as you would during an in-person visit. Let's talk about some more family-centered telehealth rights. You have the right to accommodations for vision, hearing, and speech to be able to access your telemedicine visit. For those who need extra family or support for their visit, you have the right to have a family member, support person, or other individual present with you during your telehealth visit. And for those who might need interpretation services, you have the right to access a telehealth visit in your primary language with effective and adequate interpretation services. And last but not least, you have the right to stop a telehealth visit if at any time you feel uncomfortable. Next, we're going to talk about some family-centered telehealth responsibilities. As families and patients, we have the right and responsibility to come with information. Come to the telehealth visit with information and updates about your child's health, such as celebrations in your child's life since the last visit, concerns, symptoms, treatments, or hospitalization since the last visit, medications, updates from other providers, and any other information you think that your provider might need to know. We also have a responsibility to ask questions. Just as it was a right to ask questions, we also have the responsibility to ask questions when we do not understand information or the plan of care. We have the responsibility also to take notes of any questions or concerns we have or of any orders, plans, and action items discussed during the telehealth visit. And we have a responsibility to participate. Actively participate in the telehealth visit, and then also offer our children the same opportunity to actively participate in the visit. And last but not least, we may be asked to assist with an exam. So we have the responsibility to assist with a physical exam of our children or demonstrate issues with your child's care, such as maybe a problem with equipment or supplies during the telehealth visit. So now let's get ready to talk about the actual visit, the telemedicine visit. There are a number of different names for a telemedicine appointment. You may have heard it called e-consults, e-visits, virtual visits, telecare, telehealth, virtual care, mHealth for mobile, virtual healthcare, online visits, video visits, and even a phone visit. All of these names can be considered a telemedicine appointment. So it's best to check with your provider to see what name they have decided to call the actual appointment that will be held virtually. So as we get started, I mentioned there's kind of three aspects to the appointment. We have before the visit, during the visit, and then the next steps and after the visit. Right now, we're going to focus on before the visit. What do we need to do as families before we have our telemedicine appointment for our child? Let's answer one of the most frequently asked questions first about insurance. Will I have to pay for my telemedicine appointment? The answer to this can be a little bit complicated, but we're going to break it down to hopefully simplify it. Insurance coverage for telehealth is impacted by federal and state laws, as well as insurance company policies. So it's difficult for us in this webinar to give one answer that will work for everyone. As well, telehealth policy has changed and is constantly changing with the COVID-19 environment. And there's almost daily updates, and it's been rapidly developing. So this is something also that precludes us from giving a one answer for everyone to will you have to pay for your telemedicine appointment during this webinar. But here's some things you can do. Before you schedule your appointment, you can contact your insurer at the customer service or member services phone number on the back side of your insurance card. This number will get you to hopefully a patient service representative, and then you can ask these questions of your insurer. First, it's important to start off to ask for the call reference number. That is the number that the insurance company assigns to the call, so that if you ever have any questions in the future, you can reference that call and the date and time of that call. Then you can ask them simply, does my policy cover telehealth services or a telemedicine appointment? The next thing to ask is how they define telehealth services. What's included? Does it have to be a live video? And what are their rules around coverage for a telehealth service or a telemedicine appointment? And then you can also ask them, are there any specific restrictions around the service, such as well visits only or limitations to the number of times per year? And last but not least, you can ask them if the service requires any special documentation from the doctor, such as a referral form or any other special paperwork. You can also reach out to your provider and ask them about insurance. They can help you navigate this as well. So when you reach out to them, you can call their office to schedule the appointment, and then you can ask them at that time whether or not it is covered by insurance. If it is not covered, then ask them how much the appointment would cost and if there are any discounts available. So in today's day and age, there are lots of ways to schedule the appointment. It used to be you just called up your provider and scheduled the appointment. And while that still is a way to schedule your appointment by phone, there are other options as well. We've spoken in the past webinars about portals and logging onto a portal. Some portals allow you to schedule your visit online through the portal. Also, some providers have websites where you can schedule online on their website. Some providers require that you fill out an intake form or some paperwork that you have to fill out on their website or in paper form and send back to them. And then after that, they call you to schedule an appointment. Often, many large healthcare systems use a central scheduling number. So all of the visits are scheduled not necessarily through the individual doctor's office, but through a central number that schedules appointments, for instance, for an entire children's hospital system. And then sometimes you might be seeing your specialist on a yearly or every 6 months basis. And due to the pandemic, some of those visits may be changed from an in-person visit to a telemedicine appointment. And so you may receive a phone call, a text, or even online notification of that. So let's talk about some things that you might need to think about as you're scheduling your appointment. You want to assure that your provider has your most current phone number and email on file. That is very important since everything will be done virtually. If you are speaking on the phone to someone at the office, these are some questions that you can ask. How long is the visit going to be? Do any forms need to be updated or filled out? How do I see my provider on the day of the appointment? Will you be sending me a link? Do I have to log in to a portal, or how will I access the telemedicine appointment? And last but not least, can I request an interpreter if you need that? Or do you have any other accommodations that are needed for you or your child? It is crucial that these accommodations are mentioned at the time of scheduling the appointment so that arrangements can be made for interpretation or other accommodations. Let's have a word about accommodations. As we mentioned, accommodations should be requested when making the appointment and confirmed before the visit begins. It's very difficult, as we will see in a few slides, to make an accommodation as the appointment is taking place. So please remember, before you make that, schedule that appointment and before the visit begins, to mention any accommodations you or your family might need. Let's talk about a family story. The Santiago family booked a telemedicine appointment online, and they were going to see their 8-year-old son's neurology specialist. The day of the appointment arrives, and the specialist begins to ask them questions about how their son is doing. And Mrs. Santiago, who speaks primarily Spanish, expresses to the doctor that she does not understand English well, and she asks if they could have a translator or interpreter for the visit. Unfortunately, though, because the visit has already begun and because the interpreters at this clinic must be pre-scheduled for the telemedicine appointments so they can join via another line on the call, the family is not able to have an interpreter. And unfortunately, the provider decides it is best to reschedule the appointment. And now that is delayed because of scheduling for another month's wait for the Santiago family. Unfortunately, interpretation services were not included when the family made their appointment online. So what to do in this situation? There can be some positive outcomes. So the recommendations for the Santiago family would include, again, asking for that translator accommodation in advance before making the appointment. Since they booked online, if they knew they needed an interpreter or translator, they could have called the office directly to make that accommodation. One other recommendation is to ask the provider or specialist if they have a translator available for the appointment as the appointment is beginning. So before the doctor begins to ask questions and get into the appointment, right off the bat with the first question back to the provider, asking them if that person that was requested when scheduling the appointment is available is the best timing for that. And another recommendation is to ask the insurance provider if your coverage includes translation services or if it has an additional cost. And last but not least, if you're running into any barriers getting language translation for your appointment, seek within your community and organizations such as Family Voices that offer services to families for assistance in obtaining translation services and navigating the medical system. Let's talk about another family story around accommodations, this one specifically with a hearing accommodation or interpretation. So families who have children or themselves who are deaf or hard of hearing may need interpretation accommodations to have a successful telemedicine appointment. The law requires medical providers to provide effective communication under the Americans with Disabilities Act, or ADA. So if you or your loved one needs this type of accommodation for your telemedicine appointment, it is best, again, to notify the provider at the time of scheduling your appointment. There are a few ways providers can utilize technology and sign language interpreters for a telemedicine appointment. And we're going to watch a video now that talks about some of those ways that providers can help.
There are 4 accessible ways to telehealth with your doctor. Number 1, you can see your doctor and the interpreter on the same screen. Captioning is available if you need it. Number 2, you can see the captions or cart on the same screen with your doctor. Number 3, you have 2 screens, one to see the captions and/or the interpreter, and a second screen to see the doctor. Number 4, if you are not able to use number 1 through 3, you can use VRS or IPCTS to call your doctor. Keep in mind, your doctor cannot force this option on you if number 1 through 3 are available. Instruct your doctor what kind of access, which of the 4 ways, fits your needs. Your doctor should accommodate your needs. Out of all 4 options, you and your doctor should also be able to type to each other using a chat feature. This way you can catch any misunderstandings. Typing is a good backup if there are problems with the audio and video. Your doctor should know how to connect with you on telehealth. Your doctor also should send you instructions with the link so you know how to connect. The doctor is responsible for giving this information to the interpreter or captioner.
In a pinch, if the interpreter is unavailable on the day of your appointment, we have some tips and tricks here in a pinch. So we're going to show you a video of how you can use Google Translate for language translation when you're using a Zoom account or a Zoom meeting. For those individuals who use American Sign Language, there's also something called, a couple apps called Ava that does live captioning, and one called Temi, which records what is being said and transcribes the words. There are many, many other apps out there, and these were just 2 that were recommended by some youth who have gone through an appointment utilizing these services. Let's watch that video now.
If you get stuck in a situation, you can install this on your phone in 2 minutes and then be good to go. So I want to make sure that this is ready to go. All right. So with my phone here, and I'm going to overlay this on the video, I like the conversation mode. So again, it's very similar. Up at the top, you've got the ability to choose your language on the left. That's what it's going to detect there. And then it's going to be the translation language on the right. Now there's this little thing that's right in the middle that says conversation that has 2 little people, 2 icons there. You can click that and it's automatically going to start translating in English, and then it's going to create the Spanish translation underneath. And as soon as I stop talking or tap that on the bottom side, it's going to go ahead and translate that for me.
Puede hacer clic en eso y automáticamente comenzará a traducir en inglés.
So I didn't even have to click it. As soon as I quit talking, it started doing that. Now what you can also do is you can go to auto mode, which is this little button right in the middle, and it lets you figure out, and it actually will capture and figure out what language is being spoken, and then it'll translate that automatically.
So that is just one example of how to use a device, a app on your iPhone or mobile device, or on going to the website of Google Translate to interpret in a pinch. However, this is not the most ideal situation, so we highly recommend requesting a formal translator or interpreter as an accommodation at the very beginning of scheduling your telemedicine appointment. So yay, it's time. Congratulations. You have a telemedicine appointment scheduled for you or a loved one. What's next? Let's talk about 4 things that we need to do as families before the visit. We're going to talk about space, so reduce noise environments, confidential, well-lit, internet-connected spaces. We're going to talk about equipment. What do you need to gather? Do you have your tele-ready device? Do you have your platform and portal, your pen and paper, or any other equipment? We're going to talk about information. Things like celebrations, observations, symptoms, medication lists, provider updates that you need to gather before the telemedicine appointment. And last but not least, we're going to talk about participants. Is your child going to participate? Does grandma want to join in? Do you have a home health agency nurse that would like to be there? Who is going to be expected to attend? And how to prepare the participants. So let's talk about space. A reduced noise space is definitely helpful for a telemedicine appointment so that there are less distractions and so that you can hear the provider clearly and so that the provider can hear you clearly as well. You would like to find a space that is private and confidential. So one where other individuals cannot overhear your conversation, one where there's not a lot of interruptions. And a well-lit area is very important so that the doctor or provider can actually see, for instance, if they're doing a virtual exam, they are able to see your face, they're able to see your skin, they're able to see body parts if they need to examine that with you moving the camera. And last but not least, that space needs to have a reliable internet connection. And we are going to talk about this a little bit more in detail. So if you'll remember, back when we did the other webinars, the other three webinars prior to this one, we talked about Are You Connected? And this was all about having reliable internet connection. So just to review, I'm putting up here the flow chart that you can reference from that webinar. This flowchart took you through, do you have a cell phone? Yes or no. Do you have internet service or cellular service? Yes or no. And then how to actually test the connection and see how fast that service is with a very simple website to remember, just fast.com. That website gives you a number, and greater than 15, you're good to go. If it's less than 15, you can still have a telemedicine appointment. It may just not be as reliable or as stable or fast enough. So this is a way to be able to check and verify that you have internet connection to your space. Let's talk a little bit about equipment now. So you will need a device with a camera and a microphone, and you'll also need instructions or links to see your provider. And it's best to install any apps needed for the appointment. We're going to go into much more detail about these and review from the last webinars here in a moment, but let's talk about some other equipment that your provider might need you to have. You for sure want to make sure you have a notepad, a pen, paper, and your shared plan of care, something that you can write notes down with. Then ask your provider if you'll need some of the other equipment. Some of the other things they might want you to have on hand is a thermometer, maybe a scale to check your child's weight, and maybe a blood pressure monitor. That's not required, but they might request that, and a flashlight. This would be for things like looking down a child's throat, giving a little extra light to some areas that might be dark. And last but not least, make sure you ask them if there's any other equipment they would like you to have on hand. If for some reason you do not have access to these, like the blood pressure monitor, don't worry. Please just ask your provider if they can help provide those for you, or if your insurance company would cover having one of these purchased so that you could keep it in your own home. So let's review those two pieces of equipment that we've talked about in other webinars. So back to our Fab 4 here. We have discussed in webinar number 2, do you have a device? And for your telemedicine appointment, you will need to have a tele-ready device. And you're probably wondering, what does that mean? What is a tele-ready device? Well, tele-ready devices have 3 things. They have a working computer, tablet, or smartphone, and that works and has power. That's check number 1. The second thing they have is a microphone, either an internal or external microphone, or a headphone or earbuds that has a microphone on them. That's check number 2. And last but not least, they have a camera, either an internal camera or an external webcam, and that is check number 3. And with 3 of those checks, You have a device that is tele-ready. Congratulations. During the Fab 4, we also reviewed something in the third webinar called Can You See Your Provider? And this was all the different ways that you might be able to access your provider for a telemedicine appointment. We talked about 4 keys, 4 ways you might be able to get that information. Your provider might send you an email with a link to access them. They might also send you a text that gives you a link to join the telemedicine appointment. They might have a portal or a platform that you need to log into. And last but not least, when all else fails, call your provider and ask them for their instructions on how to access them. So let's switch over to the third thing we need before our appointment to gather, which is information about our child. Family Voices has come up with an amazing worksheet that will help so much to prepare for a successful telemedicine appointment. You can see a picture of it here. Filling something out like this prior to your appointment will help you so much in getting ready for your a successful family-centered telehealth experience. Let's go through a couple of the parts of this form so that you can see what are some things you might need to gather. A list of celebrations or concerns will be really important. Changes or observations with child's health, such as mood or daily life. That list of medications and supplies and medical equipment is crucial, as well as updates from other providers, therapists, or schools. You can see here on the worksheet, this is a section that reminds you all of these things and has a place for you to write down some notes. Next, we're going to talk about the 4th thing that we need to gather and prepare before our appointment, which is the participants. This is really who will attend the visit and who will be virtual and who will be in person. And when I say in person, that might be in person in your own home. So again, let's look at the worksheet. There's a section on here that reminds you of these things and has a place for notes as well. Will your child be part of the visit? Will family members or other caregivers? Will home health or other providers need to call in? And if your child wants to be part of the visit and involved in the visit, there are some ways that you can help prepare them. There are many social stories out there for telemedicine appointments, and we have some in our resources section. You could role play with your child. You could pretend, even with doing like a FaceTime with a grandparent where the grandparent pretends they're the doctor, and you can role play and show the child how this telemedicine appointment might look. There are some videos online that you can look at, and we'll be sharing some here during this webinar as well that you could share with them. And most importantly, providing the space and items that will help them feel comfortable during the visit and in the comfort of their own home will be helpful as well. So we've talked about before the visit. Now let's switch gears and talk about during the visit and what's actually going to happen during your family's first telemedicine appointment. During the visit, do not be surprised if your child's healthcare provider needs your assistance, since they are not there in person, to help examine your child or help with your child's exam. What do I mean by this? You may be asked by your provider to take things like your child's blood pressure or temperature. They might ask you to gently push on your child's stomach or perform other procedures as requested. They also might ask you to hold your phone or computer camera to areas on your child's body so that the provider can do a thorough examination. This might include if your child has a rash or something on their back. They'll need you to help hold the phone and camera so that they can examine that. Let's take a look at what a parent helping a provider during a telemedicine appointment looks like.
As a parent, you know there's nothing more important than your child's health. At Children's Hospital Colorado, we're making it easier and more convenient to connect you and your child to the right care when and where you need it. Children's Hospital Colorado puts you face-to-face, one-on-one, with your provider or care specialist through live video through your PC, laptop, tablet, or even your smartphone. It's the same pediatric expertise and personalized experience that you expect from Children's Hospital Colorado, just from the comfort and convenience of your own home.
As you could see from that video, the dad pressing on his son's stomach and pointing to the places where the bandages were, the mom helping move her child's hand. These are all ways that parents can not only participate, but also help the providers tremendously during a telemedicine appointment. So let's talk just about a couple more tips for the visit itself. Some ideas to help kids and teens during the visit include, for the younger crowd, providing a snack or a meal before the visit can be really helpful. Thinking about things like not scheduling the appointment during nap time, and also remembering to find a comfortable location where they'll be comfortable and you will be comfortable as well. Having a favorite toy available for them to play with or to occupy them, and then having a snack or drink also available on hand should they get a need for one is really helpful as well. For the older crowd, the recommendations would be to eat before your appointment so your stomach's not growling during it, to find a comfortable location that might be in your room or on the couch. Think about things that make your comfortable environment. For instance, one family shared with us that their son preferred to have his hat over his face and not make eye contact with the computer, that was his most comfortable position. And so letting the provider know this, that you're not being disrespectful, but that this is what makes you most comfortable and able to do your telemedicine visit at the beginning of the visit is important as well. And then also have a bottle of water or a drink nearby in case your throat gets a little dry from talking. Let's look at an example of a visit with a individual who has autism.
Now, if you've got a cooperative child, being on the lap can be very helpful. But sometimes they're a little bit more impulsive. So the screen will need to be set the camera will need to be set a little farther back to give them room to roam or to play. And this is another example.
You see him in the back?
I can. That's probably why I'm doing it, so we can have a great example of how you guys can work with me while he's still doing his own thing.
Okay, good.
So, Rosie, you can come back in the frame.
There we go. We got both of us. You got Keanu. Perfect.
Yeah, awesome. And sometimes you have to wonder how much space is enough. Come on. Howdy, folks. And eventually he does come back. But sometimes a wider frame is important.
So as you can see from those video clips, sometimes positioning those who might not be comfortable right in front of the camera in the background so that they can be in a comfortable location and spot and yet still be able to be observed for the visit is one way to modify your surroundings so everyone is most comfortable for the telemedicine appointment. All right, so we've covered before the visit, during the visit, and now we're going to talk about next steps and after the visit. So some tips for next steps, going back to our worksheet, would include at the end of your visit, before you hang up, you and your healthcare provider can, at that time, discuss diagnosis and a treatment plan. Once the plan has been discussed, pause. Physically stop what you're doing and make sure you understand and are comfortable with the plan. If you're not, or you have any questions, ask them at this time. Does the plan meet the needs of your family? When you go on to schedule any future follow-ups, appointments, labs, and testing, make sure it's clear who's taking care of those orders and prescriptions and what the process is to complete the plan. Think about things like what referrals might need to be made and who is actually making them and when you should expect follow-up. Also, think about your visit. For the next time, do you need a little longer visit or a little shorter visit next time? And if there were any accommodations that could be made for your next visit, communicate them at this time. You'll also need to remember to communicate them at the time of scheduling that next visit, but if there's anything immediately apparent that you would like to change or need help with for the next visit, please let the provider know at this time. So once you hang up the phone, we're into the after visit mode, or whenever you disconnect the computer. So after that appointment, telemedicine appointment has ended, if you have any questions or concerns after your visit, please contact your healthcare provider's office, whether that be via phone or via the web portal where you might be able to use secure messaging. Reach out to your provider if you have any questions. So now we get to my favorite part. We're going to show you some bloopers or some things that could have gone better in a telemedicine visit, perhaps with a little bit more forethought. So let's take a look at some of the bloopers about food and interruptions first.
But I can tell you that they are always late. That's the one thing I know as to where they are. So I don't know. I may bail after another 5. Yep.
Dr. Goldblum, actually,
Yeah.
Mariposa can see you. You're on their camera and they can hear you.
Hi. Hi, Dr. Goldblum here. You must be Ken. No, you must be Phil. Hi, Phil. I'm Dr. David Goldblum, and I'm your consultant today on televideo. Can you hear me? Can you see me? I'm right here. Right? You got it? Okay. Good. Okay, let's get going. Okay. Right. Well, look, Phil. Let me try to summarize for you what I think is going on in what you've told me. Ever since that incident in the coal mine, you've been struggling with a depression, I think, that has not been adequately diagnosed or treated. So I think what we need to do is think about a treatment plan that could help you to just sit tight for 1 second. Dr. Goldblum? Yeah, I'm kind of in the middle of something. Well, I obviously can't see the car when it's up on the hoist, so you tell me if the tires look bad. You know, I got them last season. Look, I'm in the middle of something quite important, okay? I'll call you back. Thank you very much.
Perfect.
Sorry.
So during that blooper reel, you saw 2 different scenarios. So here's some do's and don'ts from that. Do have a snack or eat before your telemedicine appointment. That gets the green check. Don't eat while you're on camera for your appointment. That gets the red X. Also, you saw the scenario of the interruption. Do turn off your cell phone ringer or any other distractions. Try to minimize those. That gets the green check. Don't talk to others or take other calls or have side conversations during your telemedicine appointment. That gets the red X. Let's look at 2 more bloopers from cars and cameras.
Hi, Graham. This is Dr. Finkelstein. We're scheduled for your video visit. How are you?
I'm doing good. How are you?
I'm doing really well. Graham, are you driving?
Yeah, but that's okay. I do this all the time.
Well, I think we're going to have to reschedule this visit for another time.
Why?
You need to be in a private room, and then we can do the video visit in a safe environment, not when you're driving.
Oh, okay. All right. Well, then we'll have to reschedule. But are you sure? Because this seems fine for me.
I know. But you might get in an accident. That could be a problem. So we're going to do this another time. We'll see you later.
Okay. All right. Bye, Dr. Finkelstein.
Okay. Bye, Graham.
Hello there, I'm Dr. David Goldblum. You may be going through your first experience with televideo, and I want to welcome you to the new technology. Just as long as you can see me clearly, then it's going to be as if I'm right here in the office with you. So, I heard you were having a little trouble seeing me before, but I hope that this way you get a better sense at least of what I look like and how I'm reacting to what it is you're telling me.
So as you can see, this shared an example of a person taking a telemedicine appointment in their car. The do for this is to find a reduced noise environment. However, the don't for this is to have your appointment in a moving car while driving. Some families have told us, though, that because of their internet connectivity, they have trouble getting a strong connection at home. And so some families have shared the tip that they drive to a library parking lot or a parking lot of a large store or coffee shop and park in the parking lot so that they can access the Wi-Fi signal and then have the appointment in the parked car. If this is the only way that you can have access to your provider's telemedicine appointment, please let them know this ahead of the appointment or at the very beginning of the appointment. Let them know that you are not driving, you are parked, but that this is the only way that you can access a strong enough internet signal to have the visit. This should be a reasonable accommodation so that you may receive care. The second blooper you saw was with the camera. Do make sure your face is centered and entirely in the camera view. Don't cut off your head or do an extreme close-up of your face with your camera. It's best to practice this before the visit begins by using the camera function on your device. So next we're going to share a telemedicine appointment success and a telemedicine appointment done right.
Telehealth is really an example of patient-centered care where pediatric subspecialists provide care to those families in the family's home community. So there are a number of ways that the telehealth visit can be conducted. The most common way is for that family to come into our community clinic in their area and then video conference with us in Gainesville. And we've also had visits where the families will be at home and can video conference with us from the comfort of their own home. The benefits to the families using telehealth would include lack of travel time. Families don't have to miss work. They don't have to travel. They don't have the fuel expenses associated with that. Children don't have to miss school. And when you consider that many of our children also have special needs, maybe wheelchair-bound, traveling is very difficult. So if it wasn't for these visits, many of these children wouldn't have access to care. These telehealth visits allow us to catch small problems before they become big.
This is Aaron, and he have a genetic disorder, and we use telemedicine. Without telemedicine, I won't be able to see all the doctors and get the service that I get for my son.
My name is Kenna, and I have two children. Sarah is 10 and Henry is 12, and we use telemedicine. We have 5 children total. 2 of those children do have special needs, and we have to travel away from our town about 2.5 hours usually for the specialist that we need to see.
Before I had telemedicine, I had to travel 2-3 hours back and forth to see the doctor, and it was really hard. With telemedicine, I didn't have to do all that traveling. It made it a lot easier for me.
I was very hesitant at first to use technology in healthcare, to be honest.
It's been a good experience to try and just relax. And it's just like if you're having the doctor there with you.
As you could see from both the provider's perspective and the parent's perspective, telemedicine can be really helpful and make a parent and provider's job a lot easier in getting care to children, especially those with special healthcare needs. And one other example we'd like to share with you is a successful appointment for teletherapy. So not just medical appointments are happening by telemedicine. Therapy appointments, early childhood intervention visits, and many other types of appointments, including those with mental health providers, are being accommodated by telemedicine.
Okay, all right, Mia, are you ready for our exercises?
Yeah.
Okay, let me show you the first one we're gonna do. What animal do you see up here?
The crab.
The crab, let's do our crab walks. Ready? Let's do 10 crab walks. Belly up, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good work.
So as you can see from that video, even crab walking can be done virtually with our kids. So I'd like to just end up with a quote now. That's all, folks, as Bugs Bunny used to say. That wraps up our 4th webinar in the series, The Nuts and Bolts of Telemedicine. We hope that you've enjoyed this and that you've learned a lot. If you need any assistance so your loved one can have a telemedicine visit, and a successful one at that, please reach out to the nearest Family Voices office or Family to Family Health Information Center in your state or territory. If you don't know where that is or how to contact them, you can see the website www.familyvoices.org and look for the clickable map. Thank you again for joining us, and have a great day.